In this video, we will learn ECG interpretation from the beginning in a simple and practical way. By the end of this lesson, you will understand what each wave represents, what the important segments and intervals mean, and how to interpret an ECG systematically. Even if you are a beginner, this guide will make ECG reading much easier. ECG stands for electrocardiogram. It records the electrical activity of the heart using electrodes placed on the skin. Every heartbeat starts with an electrical impulse that travels through the heart muscle, and ECG machine detects these impulses and displays them as a wave on graph paper. It is a quick, painless, and inexpensive test that helps diagnose arrhythmias, heart attacks, electrolyte imbalance, and many other cardiac conditions. Now, ECG waveform. To understand ECGs, we first need to understand how electrical signals travel through the heart. The heartbeat begins in the sinoatrial or SA node, the natural pacemaker. The impulse spreads across both atria, causing them to contract. It then reaches the AV node, where it briefly slows down, allowing the ventricles to fill with the blood. The signals then travel through the bundle of Hayes, bundle branches, and Purkinje fibers, causing both ventricles to contract efficiently. The first visible wave is the P wave. It represents the atrial depolarization, meaning the electrical activation of both atria before they contract. Normally, the P wave is smooth and upright in most leads. After the P wave comes the PR interval. This measures the time taken for the electrical impulse to travel from the atria through the AV node into the ventricles. A normal PR interval is between 120 and 200 milliseconds, and a prolonged PR interval may indicate first degree heart block. The QRS complexes The QRS complexes represents ventricular depolarization. This is when both ventricles receive the electrical signals and contract to pump blood to the lungs and the rest of the body. Normally, the QRS duration is less than 120 milliseconds. A widened QRS complex may suggest bundle branch block or abnormal ventricular conduction. Because the ventricles are much larger than the atria, the QRS complex is taller than the P wave. Now, the ST segment and T wave. After ventricular depolarization comes the ST segment. Normally, it should lie close to the baseline and represents the period when the ventricles are fully depolarized. Elevation or depression of the ST segment may indicate myocardial ischemia or infarction. The T wave follows next and represents ventricular repolarization, means the recovery phase before the next heartbeat. Tall peak T wave can occur in hyperkalemia, while inverted T waves may indicate ischemia. This is the normal sinus rhythm. And each P wave is followed by a QRS complex. The rhythm is regular and heart rate is 60 to 100 beats per minute in adults, indicates the normal electrical activity of the heart. What ECG can detect? Irregular heart rhythms, blocked coronary arteries, enlarged heart chambers, electrolyte imbalance as already discussed. The QT interval basically starts at the beginning of the QRS complex and at the completion of the T wave. It represents total ventricular electrical activity, including depolarization and repolarization, and a prolonged QT interval increased the risk of dangerous arrhythmias such as torsades de pointe. When interpreting an ECG, always follow a systematic approach. First, calculate the rhythm, first calculate the rate, assess the rhythm, examine the P waves, measure the PR interval, inspect the QRS complex, Evaluate the ST segment, analyze the T wave, and finally check the QT interval. Following the same sequence every time helps avoid the mistakes. Now let us summarize what we have learned. The P wave represents atrial depolarization. The PR interval represents conduction through the AV node. The QRS complex shows ventricular depolarization, while ST segment should normally remain on the baseline. The T wave represents ventricular repolarization, and the QT interval measures the total electrical activity of the ventricles. By remembering these components and using a step-by-step interpretation method, reading ECGs become much easier. Practice with normal ECGs first before moving on to the abnormal patterns. Thank you for watching, and if you have found this lesson helpful, don't forget to like, subscribe, and share for more medical education content. Thank you.